Hi there, and welcome to Ultrasound Explained. My name's Cal, and I've been a sonographer for over 10 years here in Western Australia. What I'm going to be covering today in this video is what to expect during your scan if you're having a scan between weeks 4 and 6. Now, from my experience, this is one of the most stressful times that you can have a scan because during these times we can't see a baby and we also can't see a heart rate. And we're relying on other signs and findings to indicate that these are normal things along the way. So during this video, I hope to cover the main reasons as to why you would have a scan between weeks 4 to 6, as well as what we would expect to see between weeks 4 and 5, and then similarly between weeks 5 and 6. Hopefully by learning a little bit more about what we expect to see at these stages, it can alleviate any concerns that you might have around your scan findings and hopefully make a little bit more sense about what's happening. So what would be the main reasons that we would have a scan between weeks 4 and 6? Typically the most common one that I would see would be that the patient has an irregular menstrual cycle. So in other words, she may not know exactly when she would ovulate and therefore when conception is. Last periods are based off the idea that you have a regular 28-day cycle and ovulate on day 14, but as we know, this just isn't everyone's normal. Therefore, in these cases, we may see a mismatch to where we might expect the patient to be in terms of how far along she is and where she actually is. Sometimes a patient might present thinking she's about 8 weeks pregnant, but because she's got an irregular cycle, when she comes in for a scan, we actually find out that she's somewhere more likely between 4 and 6. Another reason why we might perform a scan at this time is that there's been some bleeding or some pain. Now, yes, this can sometimes indicate a potential early miscarriage or ectopic pregnancy, but similarly it can be normal and could just represent an implantation bleed. It's important to remember though that we may not be able to fully confirm or exclude an intrauterine pregnancy, a uterus in the correct spot, or similarly an ectopic. And the final reason as to why we may have a scan at this time is that you may just be a little bit stressed, you might be a little bit angsty, you might just similarly be really excited to see the pregnancy, and therefore you're thinking that you want to come for a scan as early as possible. I do, however, warn that having a scan in this time, it can cause or add to more unnecessary stress because effectively we're not seeing a heart rate at this stage and we can't call it a viable pregnancy. It will require a follow-up scan. So at the start of week 4, you've essentially missed a period, and that's probably prompted you to do a pregnancy test and therefore finding out that you're pregnant. If you were to do a scan immediately at this time, there's a good chance we probably won't see a great deal. The main things though that we would expect to see would be that the lining of the uterus is really nice and thick. And the reason for that is that we expect the uterus and the lining to be thickened, ready for implantation. This will allow the embryo to implant within the lining and get a preferential blood supply to help it grow. Another thing we expect to see at this stage is a corpus luteum. Now, a corpus luteum is a remnant scar of ovulation that we will see in either ovary. By finding a corpus luteum, that tells us that baby would have come from that ovary, or the egg that baby has come from that ovary. So for an example, a right-sided corpus luteum means that baby came from the right ovary. Just kind of cool to know, doesn't have any significance. But obviously at this stage, without seeing much else, it can be really difficult to know if a pregnancy's actually occurred. The only thing that's going to indicate that you are pregnant is the presence of pregnancy hormones. As we approach the mid to late 4-week period, there is a good chance that we may see a tiny cystic structure within the lining of the uterus. This is what we term a gestational sac. Now, there's a good chance that we won't be able to visualize the sac with a scan on top of the tummy. So typically what we recommend, or what we routinely offer at this time, is a transvaginal ultrasound or an internal scan. This will involve having to insert a camera into the vagina. It is a little bit more invasive. However, it does have the added benefit of being closer to the structures, and therefore the resolution is quite a lot better. By having a more accurate view, we can determine as to whether this more likely is a true gestational sac or whether it is just a simple cystic area within the lining. This can sometimes occur where we have an ectopic pregnancy and we in turn get a pseudosac. I'll be going into this in a bit more detail in a separate video. But there are some things that will tell us that it's more likely gestational in nature. At this stage, we're looking for what we call a decidual reaction. Now, this will appear as a really subtle bright ring around that black small gestational sac. The presence of this tells us that it's almost certainly going to be conceptional in nature and not just a random cystic space. But in terms of management at this stage, what we would likely do would be we'd recommend a correlation with beta-HCG again. So if you hadn't had your bloods taken for your pregnancy hormones at this stage, we would recommend that they do that. Or if they have done that, we recommend that they do it again in a period of time in the future to make sure that those levels are climbing as we would expect. We would also recommend that they repeat an ultrasound within around 10 to 14 days at this stage, because if we're thinking you're around about 4 weeks, by the time that you have the following scan, you should hopefully be around 6 weeks. So the best thing to do in these cases, if you're not having any bleeding or pain, is to try and present around about 6 weeks onwards, because that is when we expect to see a heart rate. So what do we expect to see around the early 5-week stage of pregnancy? We certainly expect the gestational sac to increase in size by around about 1 millimeter a day. So it will become easier and easier to see with each passing day. Within the gestational sac at this stage, the first thing we will expect to see before we see a baby or a heart rate is what we call a yolk sac. Now this yolk sac appears as a very small, bright ring inside the black gestational sac. And the purpose of this yolk sac is that it's going to provide the nutrients to baby before the placenta forms. And like I said, we will be seeing this before we see the baby itself. But by seeing the yolk sac within the gestational sac, it tells us definitively that it definitely is gestational in nature. As you progress through the 5th week, around the mid to late 5-week stage, you may expect to see a small fetal pole with transvaginal imaging. A fetal pole is another name that we just use for an embryo. It's normal that we can sometimes see this though before we see a heart rate. This will be immediately adjacent to the yolk sac, and we can measure it as just a small little bean-like structure at this stage. Once again, it's completely normal that we don't see a heart rate. We can measure this structure, and in combination with measuring the sac, we can get a rough idea as to how far along you are, but once again, we can't call it viable until we see the heart rate, which should typically occur within another few days around week 6. So when we don't have a heart rate, how do we actually determine how far along you are? We can measure the gestational sac and get an idea of how far along you are based off that alone. What we do to obtain a measurement of the gestational sac is we get an image of the gestational sac in 2 separate planes of intersection, and we perform 3 measurements. We then add these 3 measurements together and divide it by 3 to give us what we call the mean sac diameter. Now this number is going to be able to be correlated against weeks and days through the pregnancy, so we get a really rough guide as to where you are. Obviously, with the sac being really small, we would expect this to be around that 4 to 6 week stage, and therefore that confidently tells us that you're probably just quite early on within the pregnancy. So in conclusion, while it can be quite stressful having a scan during these stages, it does help confirm a few things for us. Number 1, we can determine that the gestational sac is within the uterus and within the correct spot. By having a follow-up scan, we can make sure that there's been interval progression from when we had your first early scan and may not have seen a great deal, to hopefully reperforming the scan around about 6 weeks to then visualize the heart rate. I'll be making future videos of what we expect to see within the weeks 6 to 8 of pregnancy, as well as a bit more detail on ectopic pregnancies and explaining the last menstrual period dates and how to understand these in a little bit more detail. I really hope you've enjoyed this video. If you have, please feel free to like and subscribe to the channel. It's completely free. It completely helps me out. And I look forward to making many more videos to help you through your whole pregnancy journey. Thanks very much, guys. Bye-bye.